Good evening and a warm welcome to all the parents present here this evening. Before we start our discussion for today, here's a little information about Mitra for Life and the work we do. We are a community working towards empowering children and young adults with autism and special needs to be independent and help them integrate better in a social setup. We have online parent forums, panel discussions, and curate new experiences, be it a day trek, festival celebrations, or musical events like Unlabel and more. We recently launched the Dad's Club on Father's Day and a youth club focusing on online socials for youngsters by engaging with college volunteers. We strongly believe in the community coming together and would love all of you to be a part of the community. Do look us up on mitraforlife.org for more details. Now, it's my pleasure to introduce this evening's guest, Vidushi Dr. Meenakshi Ravi, a music therapist and the executive director of Meera Center for Music Therapy and Education and Research under Manolasini Trust and the secretary of Indian Music Therapist Association. Dr. Meenakshi has been a psychosocial resource professional for the last 25 years, helping individuals and organizations in the field of counseling and music. Being the first family counselor at the state level, her expertise include music therapy treatment to children and individuals with challenges. Music being hereditary, she has been learning Carnatic music for 45 years and performing for more than 20 years, which has given a strong footing to blend music with social work. She has a master's in Carnatic vocal music from Bangalore University, along with a master's in social work. She has presented various papers on music and mental health in several esteemed organizations across the country. Dr. Meenakshi has organized and performed several concerts focusing on music from a therapeutic perspective and has released 6 audio CDs. She has organized many workshops and is training several music teachers and music therapists. She has received several awards for her work, including the Nation Builder Award by the National Rotary Literacy Commission in view of doing music therapy for specially abled children. She is the author of Nadamantana, a book on music for personality development. These are just a few feathers in her cap. And now we look forward to hearing more about the Indian music from a holistic health perspective and music therapy in particular. A warm welcome to you, ma'am, and over to you.
Thank you very much. I will start. Am I audible, Ma?
Yes, ma'am. Yes, you are.
Yeah. Thank you very much for Mitra Life team who have invited me to be with all of you and share my little knowledge about Indian music from therapeutic perspective and also music therapy. I'm really honored and blessed to be a part of this very innovative, genuine organization who has been doing very creative human surveys. I'll start my presentation with a shloka. Shuddha Brahma Vicharasara Paramam Adyam Jagatvyapini Veena Pustakadharini Abhayada Jadyandhakarapaha Hastaihi स्फटिकमालाञ्च विदधती पद्मासने संस्थितां त्वां वन्दे जगदीश्वरी भगवती बुद्धिप्रदा शारदा गुरुब्रह्मा गुरुर्विष्णुः गुरुर्देवो महेश्वरः गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः. Yes.
Beautiful, ma'am. Beautiful.
Yeah, I'll start my presentation with my prostrations to the Trinity and Purandara Dasa and all Dasas, all who are responsible for, Carnatic music and Indian music to be in existence, which is, infinite value and an iota of the knowledge of music.
Request you all to mute yourself.
Yeah. So my community, Tyagaraja, Muthuswami Dikshitar and Shama
I think she has a network issue. No? So we lost her, I think.
Yes, let's just give it a minute for her to get back in.
Mm-hmm. I think, ma'am, you are muted, ma'am. Still on mute.
Hello?
Yeah. Now you're audible, ma'am.
Yes.
I would like to pay my gratitude and namaskarams to my parents and all the gurus of music and all my academic career. I had a lot of wonderful teachers and I had wonderful spiritual gurus bestowed with, lot number of blessings from the divine to get little expertise from music field, counseling field and spiritual field, mental health field. It is, like a wholesome food I have been bestowed with. So this is the base for my music from holistic health perspective and music as a therapeutic intervention. Next.
Ma'am, I think you need to share your screen. We can't see your presentation.
There's the green arrow there down, ma'am.
1 minute. No. Okay, share screen. Yes. Yeah. No. Again, why it's the problem? Sorry.
It's
fine, ma'am. It just says has started screen sharing, but we're still waiting for your presentation to load.
I think I'll instead of waiting, I'll start the presentation. Just
Yes, ma'am.
I mean,
Please go ahead.
Yes, yes.
While the
Yes,
technical
no
issue is
problem. Yeah.
resolved, please go ahead. Please go ahead.
Yes, I would like to share briefly about my own story of how I could get the insight of blending music with mental health and holistic health, and work and implement music as a therapeutic intervention. The base is, as in introduction, you mentioned music is hereditary in my life. And start from maybe because my mother was a musician, my grandfather was a musician, and probably I started listening to music when I was in my mother's womb. So it really became integrated part of my life from my birth to until now. I'm 66 years young lady. I feel young mentally. Okay, and that too when I start working with my special children, they are very special to me. I call them my divine children, because where I also become like them only, like like go to their level and teach them. They are so innocent, they are so divine. It is really, I mean, I feel I can connect to them very well. This is a blessing from my from the divine, I feel. So like the music one part, and the social work perspective, I was a professional social work, MSW with a PhD in counseling. So that really gave me a strong base, like to integrate both. So when I was working as a counselor, like professional counseling, I almost worked for 15 years as a professional counselor. And counseling, it really empowers, and energizes the aggrieved party. Like, it makes them to think of the problem in an objective way and explore their inner strengths to combat the challenges or the whatever the grievances they have. So this was my profession. And while working as a counselor, I personally felt that I could get a lot of insights from music as solutions to the problems. And two, three points I would like to highlight with all of you, share with all of you. I was a patient of asthma. That was also hereditary for me. But because of music therapy as an intervention, asthma got cured for me. Because every day, there was not even a single day without music practice for me. So this really made my, lungs improvement, very, very lungs, functioning of lungs very strong. And all my respiratory these problems got solved. And whenever I was little low, like mentally, I always felt that music elevated me. Music became such a wonderful friend for me to connect to inner self. And from the beginning, because of the psychological background and social work perspective, I was so sensitive towards the meaning of, I was always used to focus about the meaning of the composition. The first composition which had, intense impact on me, it's a composition of Purandaradasa. It is a Gita. Most of you will know that this. ಕೆರೆಯ ನೀರನು ಕೆರೆಗೆ ಚೆಲ್ಲಿ ವರವ ಪಡೆದವರಂತೆ ಕಾಣಿರು ಕರಿಯ ಕರುಣದೊಳಾದ ಭಾಗ್ಯವ ಹರಿಸಮರ್ಪಣೆ ಮಾಡಿ ಬದುಕಿರು. It's such a simple Gita, but with a lot of, whole essence of human life, Purandaradasa has kept in this composition. Kereya neeranu kerege challi varava padedavarante kaaniro. See how we should be. The God has given this life with so much of, resources. We should give back to society. This type of boon, we should really think that God has bestowed on us, and we should go on doing our duty. Hari samarpane maadi badukiro. So this really had a very good impact on me. And few compositions of Purandaradasa, like Manava Janma Dodadu Ida Hani Modalu Bidi Huchapalira Manava Janma Dodadu such a wonderful composition with so much of meaning. So all these compositions, it gave me so many reflections and values, so that, like I thought I must use music as an intervention in the field of counseling. I started experimenting music as an intervention for my clients who came with a lot of anxiety, depression, negative attitude, and suicidal tendencies and tension, headaches, so many varieties of problems. I started, along with counseling techniques, I started using music as an intervention. It really gave me very good results of, relaxation, positivity, joyfulness, and, expression. Clients could really express their feelings very well. So it was a very good medium for emotional catharsis for the clients. So I started using regularly this music as an intervention. I took many, compositions of vachanas, light music also, Dara Bendre's compositions, Kuvempu's composition, which really had a lot of wonderful meaning. I started implementing, teaching them, making them to sing. I asked them to compose their problems, in a very simple language, how they could communicate. So, I mean, friends, I'm so wonderstruck. I was so wonderstruck. Everybody could, write in a Lavani type or in a composition, Bhavagita type. They could express their problems very well. So this really gave me a strong footing for using, music therapy. So after I got my doctorate in 2002 in the same field, psychosocial profile of women with marital discord and counseling intervention. I took a break from counseling field and I was teaching music. I had my music institute since 1987, Meera School of Music. So after getting a doctorate, I converted my institution to music therapy center, Meera Center for Music Therapy. I decided to use all my knowledge and experience, whatever I derived from counseling field and music field. I wanted to give to my students, like create an awareness apart from teaching the regular Carnatic music. I wanted to sensitize them about the impact of music learning to connect to their inner self. See what happens. Yes, we learn music, we systematically in a set syllabus, like we start learning from Sarala Verse to, like in a way, it's an evolutionary process. And junior, senior, junior, senior proficiency exam like that, it is, formal learning. What I was concentrating, I started orienting the children how it is related to their personality, growth of inner self, how their inner blossom could be, inner self could be blossomed through music. Music for personal excellence, music for leadership, music for, concentration, increasing memory power, all these elements, I started orienting them. The normal children, I was just teaching them. I think in 2002, I got one boy who is a multiple disabled. He's, cerebral palsy, blind, juvenile diabetic, and with hearing problem. He came to me as, I should be very grateful even today because he made me to learn music therapy. Anyway, I had, and all musicians had discarded, they couldn't accept him to teach, they couldn't teach him. So he came to me. I think it was a boon for me. So I started, holding his hand and, cerebral palsy, like he has got no voluntary communication. So many, challenges he has, health challenges. So I used to hold his hand and teach him tala, and, I started teaching him music. So Carnatic music, chanting of Omkara, bhajans, Sanskrit shlokas. So I started creating a module for special children. After that boy, many children started coming to me, children with autism, mental retardation, learning disabilities, and, this one, ADHD, Down syndrome, all types of, children, their clients started coming to me for music therapy. So it was a learning process for me, but fortunately I knew how to handle them because of my counseling background, how to take their case history, understand them from totally family perspective, and how to counsel parents. Since I had all the professional skills and techniques, and I knew music, both I could combine and started administering to the children. So over a period of time, music therapy started catching up in my center. And fortunately, my husband is a very good Mridangam artist. He also started applying rhythm therapy, how rhythm plays a predominant role in addressing the challenges of children with special needs. So we started working together, and I started training. In my center, it is 1-to-1. So there is more focus is given to individual teaching. Once in a month, I used to arrange for group therapy sessions. I used to make them to sing in a group, and they used to perform every month. Every month, I used to arrange programs for Vikasana programs, and all. It was an integrated, like how you are doing. I really felt so happy to know about the center, because you are working to bring them to the mainstream of society, and they should really they should blend with themselves with the normal stream. It's an excellent, a very noble concept. Same way I started, it was an integrated school where normal children used to come and even special children used to come. I used to make them sit together, learn together. This journey, long journey, made our parents of normal children to give more support to special children. And even the normal children, they started, accepting these children and, encourage them and sing together. In many programs, I used to make that, or they used to sing together, both normal children and special children. It was a wonderful journey. So like this, I almost more than 200 to 250 patients I have handled so far. But what is important is like what significance results I have seen in music therapy. See, what is music therapy? I would like to tell you first. Music therapy is a non-invasive supplementary therapeutic intervention to address to the needs of children, individuals with physical, social, psychological, or emotional, or even spiritual needs. So many types of, needs or so many types of, all types of needs are being met or being addressed with the help of music therapy intervention. Music therapy can be administered from two perspectives. One is this one, as a therapeutic intervention. Another dimension of music in our school is holistic health perspective. I have been working with the 4 objectives of music for holistic health. That is, music as a promoter and also as a medium to maintain the psychological or emotional health. Music as a promoter of...
Ma'am, sorry to interrupt you.
Yeah.
The slide is not moving forward.
Yes, ma, I don't know really.
It's just at one screen, and I
yeah.
Yes, ma'am.
Now you can see?
Yes.
Next is madam. Yeah. See, vision and objectives of, I established 2 institutions. One is Meera Center for Music Therapy Education and Research in Bangalore. And I was in Hyderabad for 6 years. There also I established Nadamaya Center for Music Education. And there also, I had about 20 special children, more of autism and other ADHD and Down syndrome. Such children I used to come. They used to come for music therapy. So far, I have, organized many educative programs, workshops on music therapy, then, spiritual symposiums, lecture demonstrations, music and spirituality, Nada Yoga programs, all music therapy sessions, every week I used to have, weekly twice or thrice I used to have music therapy sessions for all. It was, as I told you, it was individual case study method I adopted, and definitely not I couldn't do individually for all children. So I started training my teachers who were with me to be therapists, to be music teachers and also therapists. Since I had theoretical inputs and also practical experience, so I started educating them. I started training them to be teachers with a meaning. Like they should give the meaning to the children. They should make the children to understand why they are learning music, what are the benefits of learning music. That is one part, holistic health perspective. The next one is therapeutic perspective. So because I had very good teachers who supported me, who became therapists now, I could cater to almost 200 to 250 special children. So two books were written about music from holistic health perspective and also music therapy. One is Nadamantana and another is Health and Harmony, a beginner's guide to Indian music and holistic health. Yeah, so far 40 years of dedicated experience I have, and more than 1,500 programs have been conducted, and more than 200 music therapy beneficiaries are there in our center, and 300 students have been trained in classical and devotional music, and 15 music teachers have been trained, and 10 music therapists have been trained so far in our organization. Yeah, so what is the concept of music and healing qualities? I will sing a song. It's in English. It will give you the wonderful concept of music and its healing qualities. It is in the Raga Shankara Bharana of Carnatic music. Sari Gama Padani Sari Magari Sa La 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 Music is melody, music is rhythm, music is harmony, blended with pitch and tune. Music is melody, music is rhythm, music is harmony, blended with pitch and tune. La 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 la. La 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 Music makes me joyful, music makes me peaceful, music makes me joyful, music makes me peaceful, music makes me playful, music makes me soulful. La 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 la. Music is melody. Music is rhythm, music is harmony, blended with pitch and tune. Music makes me hungry, music makes me sleepy. Music makes me hungry, music makes me sleepy. Music makes me active. Music makes me focused. Music makes me active. Music makes me focused. La 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 la. Music is melody. Music is rhythm. Music is harmony blended with pitch and tune. La 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 la. 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 La 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 la. La 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 la. La 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 la. La 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 la. La 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 la. Music is everywhere. Music is all the time. Music is everywhere. Music is all the time. Music is my friend. I love it forever. Music is my friend. I love it forever. La 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 la. Music is melody. Music is rhythm. Music is harmony blended with pitch and tune. La 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 la. La 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 la.
Wow, that was lovely, ma'am.
Yes, all of you can learn. It will be very good to sing in a group. Yes.
Yeah, I mean, the way you blended the concept,
Yes.
Yeah.
and put it to tune to explain, that was
Yes. You know why I
very
did?
unique.
I had a wonderful opportunity to conduct a workshop on Carnatic music therapy for children with autism in US. 15 children participated for 15 days. It was a workshop for children with autism, and they really enjoyed it so well, and I had wonderful experience, and they wanted to continue. In fact, many children are even now, they are continuing music therapy from me and my husband. So now, like, healing qualities you understood. It makes us very happy, joyful, blissful, active, positive, and when you really sing from within, you really feel hungry, and you can really sleep very well. And it makes us to wake up also. We wake up with music, and it has got 100 number of healing qualities. And music is everywhere, it is part of the entire universe. And music is melody, which is universal. Music is present throughout the universe, and it is spiritual. What is spiritual? I want to explain in a very simple terms. See, when I talk, it will go to your intellect. When I sing, you will forget everything. It directly goes to the soul. It will directly make you very happy. Is it not? You will forget yourself. You will forget your body, mind, intellect, everything is, you will not identify yourself with these components. Music elevates directly to the soul or the chaitanya or the spirit of the individual. This is the beauty of music, why music is very spiritual. Because spirituality also, it is the Atma, the soul. It's the science of the soul. Music and spirituality, they are two single faces of a single coin, two faces of a single coin. So this is the beauty of music. That's why music is very spiritual, more so with Indian music, because I will come to that. Indian music, then I stands for MUS. I stands for identification of the self with the vibrations. Okay, when I sing, I am 100%. I'm getting involved with the vibrations of the sound. Beautiful sound, ragas, rhythm. So many components are there. So I'm completely identifying myself with the vibrations, which makes me C stands for calmness and creativity. This is a beautiful definition of music. Melody, which is universal, which is spiritual, and the identification of the self with the vibrations, and which makes us very calm and creative. Another beauty of music, why it is therapeutic, I am just singing. I am not aware of, what is happening within myself. I am not aware. I am singing, but the whole process, so many types of processes are taking place without my knowledge. That's why I'm finding 100% improvement, significant improvement among children with special needs, especially autism. Normally, what are all the issues? Restlessness, lack of eye contact, speech clarity, communication skills, eye to eye contact, social interactions. You find problems in all, and even learning, even problems in learning. So many challenges they have, is it not? All of you have been working with children with autism, individuals with autism. These are the problems of autism. But through music intervention, whether it can be vocal or it can be instrumental, all these challenges will be definitely, it can be addressed, and significant improvement we can see in all their issues, redressal of their problems. Because I have been working for the past almost 3 decades with children with special needs, I find a lot of improvement in all these changes, their needs, because music makes them very happy, and it increases their self-confidence and self-esteem level. Because, see, I just quote one example. One boy of autism in Hyderabad, he came to me when he was 5. He was a client of moderate autism, and he was so restless. There was absolutely no communication, and there was no clarity of speech, and he was hyperactive, and there was no eye contact also. All the issues were there. Within 4 years of, normally I involve mothers in the treatment process, because until the child establishes rapport, and until the child comes and sits at least for a few minutes and starts learning, we involve mothers. We recommend for mothers, involvement in learning process. When mother starts learning, definitely gradually, and we record the sessions, whatever we do. So when mother starts learning, gradually the child automatically it will start learning. Probably he will be jumping or roaming around the center, and used to roam around even at home, normally the typical features of autism. But they would have learned all the concepts of music. They would have learned the tune and the rhythm, and they start humming, and gradually over a period of time, when the beautiful rapport established between the therapist and the child, all children, they start learning very well. And I make them to sing in front of others. And unfortunately, because of corona, all personal programs, I used to arrange creative programs blending both normal children and special children. We are missing it, but still we have been doing online only. Children felt so happy, and I used to give them some small prizes. My God, so much of confidence level, improvement in self-esteem level, singing, abilities, so much they could improve, and amazing improvement in all their whatever challenges they have. It could be addressed. Music intervention, music therapy intervention, addressing the needs of, or the challenges of children with special needs. Especially autism, I would like to focus more, because invariably all children with autism have got an immense interest in music. It can be rhythm oriented, or it can be some instruments, or it can be vocal also. So the music as a therapeutic intervention has got 100% positive impact on children with autism. You can take it from me, and definitely over a period of time, they will improve in musical skills. This is the best therapeutic intervention I can say. because the feedback given by the parents so far, they say that, ma'am, we take them to so many therapists, but my child is very happy with music therapy. And even we feel so relaxed because you know the plight of parents, how much stress they have, even to handle these children, it is a Herculean task. Okay, really, I pray my special pranams to the parents, because so with so much of patience and unconditional acceptance, whatever the trauma they undergo mentally, like, psychologically, financially, physically, everything they have to endure. They need a lot of strength and positivity approach, positive attitude in themselves. Music therapy is not only for special children, but also for parents also. Because in my experience, in both of them, both parents, they used to come and sit in my session. They used to love the session. They used to tell me, ma'am, we'll be waiting for music therapy sessions because we feel so relaxed and the child is so happy relating to you, that beautiful relationship what we build with the rapport with special those children. And they used to learn music in their own pace. Definitely it is not music teaching like how I teach special normal children. Normal children have got a set syllabus. Accordingly, I need to teach and I should be strict with them also. But with these children, what worked is unconditional love, unconditional acceptance, and, physical, positive strokes to them, and very good, that warmth and empathy, understanding them, go to their level and teach them. 100% improvement we can find through music. Why music is like that? Because Indian music is, it has immense depth and diversity. We know India is full of different various types of diversified cultures based upon religion, based upon geographical domain, based upon language, culture, tradition, and whatnot. And we have different forms of like Indian music, like we have classical music, Hindustani and Carnatic, and we have devotional music, bhajans, light music, then folk music, then abhangs, Rabindra Sangeet, so many. This one, Lavanis, Vachanas. When it comes to South India, we have Basavanna Vachana, Bhavagite, folk music, film music. My God, India is very, very rich in music. Musical treasure is very, 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 what do you say, very which vast treasure we have. Unfortunately, what has happened, Indian music has remained like, just entertainment and kacheri, learn, teach, make money, and through medias also, only it is only for, by and large, it is for the external, the benefits. I don't say it should not happen. This is definitely needed to promote our Indian music. But to deal how it is related, how it is integrated to the inner self, that is very important. How it is related to the holistic health of an individual. This aspect, actually, foreigners, in their music, they have explored to the maximum. And music therapy is part and parcel of the treatment process in all the Western countries. I had been to US in 2013, and I really, I was so happy to see music therapists, certified music therapists are there. Music therapy is part and parcel of the treatment process in medical, psychiatric, rehabilitation center, geriatric centers, special children's schools. My God.
Ma'am, so sorry to interrupt.
Yes.
Actually, no, because we also have a lot of questions and comments coming from the audience, and we're also, I think, running short of time.
Yes.
So I would also like to take a few questions in between, if that's okay with you.
I will conclude, then we can come to questions.
Okay,
I'm just going to conclude.
Sure. Okay.
Yeah? Another 5 minutes, I'll conclude.
Okay.
Because the major essence I have already given.
Yes.
So, what are the autism? What is autism? All of you know. What are the symptoms? I need not tell. So, what is, say, what I would like to say is, like, music therapy like, like if it is really practiced properly, if it is given properly, proper dosage, I like, we have our own module I have created if we're using Carnatic music, and we have chanting of Omkara, Sanskrit shlokas and bhajans, and I have created my own module of Carnatic music. There are so many varieties of techniques in Carnatic music which we use for children, to learn to address all their issues, their sensory issues, tactile issues, and speech, that all eye contact. And eye contact, I would like to just share one experience. They cannot close their eyes even for 1 single second, but I started experimenting chanting of Omkara, closing their eyes with one. I started from 1. All children now, most of the children, they are able to close their eyes and chant Omkara for 21 times within a matter of 6 to 7 months. This is a wonderful, actually, I want to publish this, what is the observation, what is the results, and they have become very focused. All the, whatever the, battery is running low. How come? Just a minute. So all these issues, like definitely they can be addressed through music therapy. And apart from me, there are 3 more therapists in our center who are doing excellent work, catering to the needs of children with special needs. And also, I have started a training program to train music therapists, because there has been a lot of demand for music therapy with lots of individuals with special problems. So 12 aspirants have registered for the music therapy course. It is for 6 months, and 2 modules. Two modules will be given within a year. So so we are very, very optimistic about more music therapists in Bangalore. So at least to begin with, we are focusing on this, and this is in nutshell. It's a very vast subject. I hope I have made it clear to you with focused points. So now you are open to questions.
Thank you so much, ma'am. That was really wonderful to know about your work. And music therapy itself, I think, is a kind of a new topic for most of us parents, because as therapy, we usually only look at the other prescribed therapies, So this was really an eye-opener to know that it can really help us and help the children. So a lot of parents have expressed that music has, their children are very interested in music in some way or the other, just by listening even. So I think they're all now inspired to try this out.
Yeah.
So also there are a lot of inquiries if, how they can start music therapy and if they can even get in touch with you. So maybe we'll share your details with them on our forum, and maybe they can get in touch with you.
Definitely.
So there's a question from Mr. Krishnan Iyer. Is there an age limit for a person with autism to join?
Actually, there is no age limit, but all of you know, early intervention is always better.
He says he has a son who is 29 years old. He's a young adult. So
I can see him, and I can definitely guide. If he is really interested in music, we can definitely find ways to make him to learn, and as a therapeutic intervention, we can definitely try.
So we also have a question. My son from Nivedita. My son is 2 years and 7 months old, and I sing for him. And I also do classical dance. He is much inclined to the song than my dance. So will music therapy then help in speech at this age, or should it be later? He doesn't
actually, if he is
the activity.
If the child is really interested, at least if we can utter few syllables, definitely we can start. Definitely we can start. We can train the mother. If mother starts singing at home, no, automatically. I'm so happy to tell you, in most of the children with autism's families, both the parents sing for the child. All three together, they sing. You know, in the evening times, they sit together and they make the child as a teacher, and both the parents learn.
Okay.
And it has brought in a lot of positive family atmosphere.
Mm-hmm. Great, ma'am. So next question, Mr. Satya J asks, can we play a background music while teaching academics? And what music to play for relaxation before sleep? The two questions.
Yeah. Actually, there are various types of recordings available in YouTube. So what I prefer as a therapist, normally for sleep, very mild flute is recommended. Flute will be very good rather than any other instruments, violin and, everything has got its own positive impact. But flute makes very, peaceful.
Right. And what about for academics, ma'am? Background music during academics?
It really helps for them to concentrate and, to relax. But it depends, some children might feel it's a disturbance. If they prefer silence, that is good. Okay. If some children, many of my students, they used to put music and they used to do maths and, they used to excel. So it depends.
Okay. Now there are some questions saying, is there any specific raga for a particular thing, like a raga for anxiety or a raga for speech or something like that?
There are, but see what has happened in Indian music right now, nothing has been scientifically proved. It is experiential. From my experience, I can say that if you listen to Neelambari Raga or Ananda Bhairavi, or Kulabharana, it really soothes you and you go to sleep. But it is universally accepted, at least right now. If you listen to Neelambari, you go to sleep. Neelambari has been there since the ages. It has already been, it was in Veda's time also. Neelambari, it's very, it comes like this. Shri Hayavadana Lali Shri Govinda Lali. It is like, oscillating of totally iruttalla. A total tugavaga henge barutto, ade tara barutte raga. It's like that.
Very nice, ma'am. Yes.
Any raga for memory and concentration? Yes, there are many ragas. There are ragas for soothing. There are ragas for stimulating positive energy. There are ragas to address all issues, like to overcome from depression. There are many ragas for each need.
Right. So, ma'am, how do you introduce music to a child that is non-verbal?
Non-verbal, probably, yeah, I had many cases like that. Non-verbal is listening to music. We can start with that. Okay. And we tried Omkara chanting for that one. It really worked, like we tried intensively. Probably almost for 6 months, we tried, mother and me, we used to sit together and try to make the child. The child could utter that much it could do. Still, we had to work. It's a very long. Or the child used to learn mridangam. He used to do very well. We used to understand the concept and he used to play. Because first. And what I would like to emphasize, Samyukta, commitment on the part of the parents is very much important. Commitment and conviction in the treatment process. And they can't expect radical results. It is a very long-term process. The more you get involved in the treatment, the better the results.
Yes, ma'am, of course. So a lot of parents are asking to speak to you regarding, classes for their children probably. So I'd like to tell the parents that we will be sharing the details in the group.
They can contact me
Excuse
after
me, ma'am.
Monday.
Contact, ma'am.
Excuse me, ma'am.
Tell me.
My son wants to speak.
Oh, yes, sure, ma.
Matado. Good evening, ma'am. Good evening.
Who is that? What is your name?
Hello. Suhag. ಮ್ಯಾಮ್ ಅವನು ಸ್ವಲ್ಪ ವರ್ಣದವರೆಗೂ ಹೇಳ್ತಾನೆ ಸ್ವಲ್ಪ.
ಓಕೆ.
ನಮ್ ತಾಯಿನ ಹೇಳ್ಕೊಡ್ತಾ ಇದ್ರು, ಬಟ್ ಅವನು ಲಿಸನ್ ಮಾಡಿ ಹೇಳಿಸ್ಕೊಳ್ಳೋ ಅಷ್ಟು ಪೇಷನ್ಸ್ ಇರ್ಲಿಲ್ಲ ಅವಾಗ.
ಓಕೆ.
ಇವಾಗ ಅವ್ನಿಗೆ ಸ್ವಲ್ಪ ಕಲಿಯೋ ಇಂಟ್ರೆಸ್ಟ್ ಇದೆ. ಅವ್ನು ಹೇಳ್ತಾನೆ ಯಾವ ತರ ಕಲಿಬೇಕು ಅನ್ನೋದು. ನಮ್ಗೆ ಅವನು ಓಪನ್ ಅಪ್ ಇಲ್ಲ, ಸ್ಪಷ್ಟತೆ ಇಲ್ಲ, ಸ್ವಲ್ಪ ವರ್ಡ್ಸ್ ಅಲ್ಲಿ ಅವ್ನಿಗೆ ಸ್ಪಷ್ಟತೆ ಇಲ್ಲ. ಅದೇ ನಮ್ಗೆ ಬೇಕು, ನೀವ್ ಹೇಳ್ಕೊಡ್ತೀರಾ ಇಂಡಿಪೆಂಡೆಂಟ್ ಆಗಿ ಅಂತ.
ಈಗ ನಾನು ಲೆಟ್ ಮಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಟು ಯು. ಐ ಆಮ್ ಆಲ್ರೆಡಿ ಟ್ರೈನಿಂಗ್ 12 music therapists. They are very much, focused. They want to give back to society. This corona has given a lot of good insights to all of us. So I'm very, very happy that many of them, they know music. They want to understand the concept of music therapy and start giving to the children. Okay, right now, you are seeing me. I'm not very young. Definitely, I will make arrangements for you to learn music. If whatever best I can do from my side, I will do, or else I will arrange for good music therapists to you. Okay.
Right. Ma'am, there's a question from Nivedita. She'd previously asked also about her son. He speaks like a song. I thought it would change, but he keeps singing something all the time. So is it okay to put him in music therapy? Because she says she's worried that what if he gets addicted to music and stops speaking? So it is just my fear.
I should look at him first. I should, understand him. Then we will try. We will try what best we can do. At least music, he can definitely sing for many hours, but he should speak also, no? We will see what best can be done.
Okay, ma'am. So before we end, just one last question, ma'am. I just want to ask you, like you yourself mentioned that a lot of teachers are usually reluctant to take children with special needs because they may not know how to handle them, and but when music is helping these children in such a large ways, what is your message to these teachers?
I really request all the teachers to, at least see, it should be an integrated approach. When as a music teacher, when I am teaching 50 children, I can take 5 children, and all these teachers should be trained first of all, not all can have that empathy, patience, and, acceptance. So most of the children had a very bad experience of going to them, and, they were discarded. And ultimately they came to me, ma'am, nobody teaches. And that even what they're scared is, even other children might, it might affect them, the behavior of these children. So I can't say that they're completely wrong, but if they're more understanding, they can create an awareness among normal children also, like to accept them. If teachers can accept them, normally that sort of a conducive atmosphere will come for special children. It should be an integrated approach, even in normal school, music schools. I don't know whether it will come or not, but hope so.
Yes, we do hope for more teachers to come forward.
Yes.
And
I'm telling you, Samyukta, I'm telling you, all friends of Mitra Foundation, very, very difficult to get music therapists in Bangalore, I'm telling you, because there are very, very handful of me. Dr. Geeta Bhatt, I think you must have known. You can invite her also. She's a psychologist, adult and adolescent and child psychologist. And she's a, she has taken RCI special training as a special educator. She is a Veena player also. Very committed for the cause of music therapy. So for most senior is me in Bangalore, and other one she is doing. And I really wanted to expand these music therapists, that's why I started training them. At least if we have about 10 to 12 music therapists in Bangalore, minimum to begin with, we can do some justice to these children. And invariably, you must have seen all these children are interested in music.
Yes.
In one form or the other.
Correct, definitely.
And many times I really feel we can teach these children so easily than normal children. And they'll be so devoted to us. I don't find that type of connection with normal children at all. They are so much attached. They love unconditionally. All of you must have experienced how friendly they are, how, they'll become so close. They ask so many questions, personal questions. One of 30 years old boy with autism, he was asking me, why did you stop dyeing your hair? Ma'am, you were looking so nice. That time also you were looking nice. No, it is okay. Like, so innocent. And whenever I'm teaching, he used to ask me for his hand. Can I hold your hand, ma'am? Will you teach me holding your hand? The best part of my life, I'm telling you, when I connect to these children, when they sing, and when parents feel very happy, Sarthaka Janma ansutte nanige. I feel so satisfied.
Wonderful, ma'am. Thank you so much for sharing your journey with us today. Any other questions, parents? Otherwise, we can conclude the session. We've already overshot the time, I think.
Hello. So I have a question, like, how will we know, like, means what, if the kid will be interested or not? Means my kid likes music, but I'm not very sure if music therapy will work for him. So how will we get to know? Will there be any
if the child is, if the child is interested in music,
but he's not interested in every form of music. He's very selective.
No, let us give whatever he likes. No.
Okay.
Some children, they like only rhymes.
Yeah.
So there are such type of rhythmic songs only they are being taught.
Okay.
I have 2 more therapists who are working with me. So they are very, very resourceful about all these small songs, like for the children can comprehend and learn. And since we record the sessions, children really, they find it very interesting to watch that video or listen to the audio, and they learn very fast.
Hello, ma'am.
Tell me.
ನಮ್ಮ ಮಗ ಸುಹಾಸ್ ತುಂಬಾ ಇಂಟ್ರೆಸ್ಟ್ ಇದೆ ಮ್ಯೂಸಿಕ್ ಅಲ್ಲಿ. ಇವಾಗ ನಿಮ್ಮ ಇಂಡಿಪೆಂಡೆಂಟ್ ಆಗಿ ಹೇಳ್ಕೊಡ್ತೀರಾ ಅಲ್ಲೇ ಕ್ಲಾಸಸ್ ಅಥವಾ ಆನ್ಲೈನ್ ಅಲ್ಲೇ ಇದು ಮಾಡ್ಬೇಕಾ?
ಅಲ್ಲ, ಈಗ ಇಂಡಿಪೆಂಡೆಂಟ್ ಪರ್ಸನಲ್ ಆಗಿ ಯಾರಿಗೂ ಇಲ್ವೇ ಇಲ್ವಲ್ಲಪ್ಪ, ಬಿಕಾಸ್ ಆಫ್ ಕರೋನಾ. ಸೊ ಇವಾಗ ಎಲ್ಲ ಆನ್ಲೈನ್ ಅಲ್ಲಿ ಮಾಡ್ತಾ ಇದೀವಿ. ನನ್ಗೆ ನಾನು ನೋಡ್ತಾ ಇದ್ದೀರಲ್ಲ, ಸೊ ನನ್ಗೆ ಸುಮಾರು ಜನನ ಎಲ್ಲಾನು ನಾನು ಡಿಸ್ಟ್ರಿಬ್ಯೂಟ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಫಾರ್ ಮೈ ಥೆರಪಿಸ್ಟ್. ಸೊ ಐ ಕಾಂಟ್ ಹ್ಯಾಂಡಲ್ more children now because of my health issues and voice, voice should also permit. But it's very straining on the part of the therapist, we need to have more energy to cater to the needs. One session 30 minutes to 40 minutes antandre it will go for 1 hour, because it depends upon the behavior of the child in the session.
He is very much interested in music.
Yeah, I request the parents, we'll be sharing the details. So for personal admission, you can speak to her later, or you can contact her center separately.
Yeah.
Okay. So thank you so much, ma'am. Wonderful session. And we also request you to send us a recording of the song that you just sang.
Definitely, I have the video.
I am sure all the parents enjoyed it, and they also wanted.
Please share us.
Sure. Definitely, I will share. See, all my dear parents, what I can do, like I have lots of shlokas, small shlokas and bhajans. Okay, I'll record and pass it on to Samyukta or Arpita.
Yes, we will share it in our
see,
group.
chanting of Sanskrit shlokas has got immense value, immense impact on children's, clarity of speech, and even it works on the brain very well.
Right.
And it has been proved, and I have experienced all my children, they sing almost 30 to 40 shlokas at a stretch sitting tolerance, amazing improvement, clarity of speech, chanting of Omkara and bhajans with movements therapy. So I forgot to tell you. Like, for example, see, sa, pa, and they will not understand the hierarchy, no, see, sa, ri, ga, ma, pa, da, ni. Like the dance movements ಮಾಡ್ಕೊಂಡು ಹೇಳ್ಕೊಟ್ರೆ they understand very well.
Right.
And ಈಗ number numerical sa, sa, ri, ri, ga, ga, ma, ma, pa, pa. What is the number? 2.
2.
You do 3. Sa, 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 ri, 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 ga, 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 ma, ma, ma. They do up to 10. So numerical numbers can be taught so well utilizing music. And I'm telling you, music is wonderful intervention. Okay, maybe it will take some time for me to allot therapists for you. But until that time, I'll be sending all my recordings to all of you. That I can do.
Yes, ma'am.
And I will
Wonderful.
record the techniques
Can I
also.
ask question?
Tell me, ma.
Yeah, ma'am, I'm from Bombay. My
Yeah.
son Rishikesh, he is learning keyboard and he's doing fine arts, ma'am, right now. I'm
Very
facing problem with concentration and memory, and he's having epilepsy also. So that drugs are having some problem, side effects for memory. So please let me know the ragas which will help him so that I can train him over here.
Yeah, definitely. And see, there are some shlokas which have got therapeutic value. Okay, I will definitely send the recording of those shlokas. You can learn those shlokas for specific problems.
Thank you, ma'am.
Okay.
Thanks a lot. Thanks.
Yes.
Thank you.
Ma'am, we have a question from Mr. Rodriguez. How is English country music for kids?
English music, definitely. English music also, depending upon the culture, depending of the culture and tradition and the religion. So we need to adopt those songs or those tunes depending upon the need of the need and interest of the client and also the parental background.
Right.
If the client is Muslim, I can't ask him to chant Omkara. He will slap me. So depending upon their culture, we need to derive songs or derive tunes which can create interest in them. And there are 2 types of therapy. One is passive therapy and active therapy. Passive therapy is listening to music. Active therapy is get the child involved, get the client involved in learning.
Okay. All right. So, any other questions, parents? Otherwise, we can conclude.
Me. What do you want to ask?
ಹಲೋ
Tell me.
ಮೇಡಮ್ ದಿಯಾ ಫೌಂಡೇಶನ್ ಅಲ್ಲಿ
ಹಾ
ಪ್ರೊಫೆಷನಲ್ ಆಗಿ ತಗೊಳ್ಳಿ ಅಂತ ಸುಹಾಸ್ಗೆ ಅಂತ ಹೇಳಿದ್ದಾರೆ. ಸಿಂಗಿಂಗ್ ಪ್ರೊಫೆಷನಲ್ ಆಗಿ ತಗೊಳ್ಳಿ ಅಂತ ಹೇಳಿದ್ದಾರೆ.
ಎಕ್ಸಲೆಂಟ್.
ವಾಟ್ ವೇ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ಸ್ ಅಂತ ಪ್ರೊಫೆಷನಲ್ ಆಗಿ ತಗೊಂಡ್ರೆ ವಾಟ್ ವೇ ಇಟ್ ವಿಲ್ ಹೆಲ್ಪ್ಸ್ ಅಂತ.
ಅಲ್ಲ, ಅವ್ನು ಪ್ರೊಫೆಷನಲ್ ಆಗಿ ತಗೊಂಡ್ರೆ he can start teaching, no, he can become a teacher. And one of my adult, he is around 30 years, autism ide avನಿಗೆ. He has joined BA in music.
Okay. He is now 22 years old.
ತಗೊಳ್ಳಿ, ಮ್ಯೂಸಿಕ್ ಎನ್ಕರೇಜ್ ಮಾಡಿ ನೀವು. And most of my, I'm very happy to tell all of you, most of my clients, parents, they say that, ma'am, among all the professions, let my child become a bhajan teacher, music teacher. We are very, very happy, ma'am. Just say.
ಬಟ್ ಅವ್ನು ಓದಕ್ ಬರಲ್ಲ, ಒಂದ್ಸತಿ ಹಾಡು ಹೇಳ್ಕೊಟ್ಬಿಟ್ರೆ ಮೆಮೊರಿಲಿ ಉಳ್ಕೊಂಡ್ಬಿಡುತ್ತೆ.
Very good. Please encourage him in whatever field he is interested.
Okay, thank you, madam.
There's allopathy medicine for autism go well with music therapy. or does it have? I have no idea, ma. Autism ge medicines ಕೊಡ್ತಾರಾ? ನನಗೆ ಇಲ್ಲಿ ಬಂದಿರೋರು ಯಾರು ಹೇಳಿಲ್ಲಪ್ಪ medicines ತಗೊಳ್ತಾ ಇದೀವಿ ಅಂತ. Normally they say no medicines, only with therapists, only through therapists they should get modified unless they have other some health issues.
Yeah, it depends, I think, ma'am, on the condition and the individual. Okay, ma'am, thank you so much. It was a wonderful session. So maybe we'd like to.
Ma'am.
Yes.
I want to ask something.
Yes, who's this?
It's me, Kumuda.
Yeah, please go ahead.
Yes.
Yeah. So since like I'm very good in singing. Like I'm like very good singing. Like each, like when I go any functions and all, like when I sing over there, people like, I don't know how, like people like always like put very big hands and they shout. After that in school also I sang one song and again like people praised for me. After that, like 5 days, like after like 6 months like that, I started like, I don't know why I started liking keyboard and all. So my interest like went on keyboard now.
Okay.
It went on keyboard. So now in keyboard, I started learning all my lessons on it. So I just like took easy to learn keyboard from like, actually I don't go for classes and all, but since this COVID came, so I decided to learn for myself. So I learned like so many, like not shlokas and all, like some random stuff I learned in keyboard and all without anybody's help, like that.
Very good.
That's the thing.
Good. Keep it up. But you can sing also.
Yeah, excellent than that.
Then you should continue. Why did you stop? In fact, I suggest all parents to learn music. What I have observed, Samyukta, the more, see, all my parents, you should see, I will give Nada Arogya channel. Please go to the channel. There is one channel I have created for creating public awareness about music and holistic health. And children with parents with autism, they have given feedback. What was the impact? They started getting a lot of benefits. Many mothers have become, music teachers now. They feel, ma'am, it is so relaxing for us also. And even fathers also join, I believe, at home. So that inclusive approach, no? So when they know that, yes, music yaar help agalama. Music helps everyone. So when they start understanding, oh, my son is improving so well, let me learn shlokas, let me learn bhajans. And ಈಗಿನ ಕಾಲದ ಮಕ್ಕಳಿಗೆ ಸಂಗೀತ ಬೇಕೇ ಬೇಕು ಚಿಕ್ಕ ವಯಸ್ಸಿಂದ. If they, especially in Corona, I'm finding even normal children very difficult to handle for parents. So everything has become, like technology oriented. Yes. Hardly they have any personal touch, no playing. My God, it's very, very difficult, and more so with special children. Very difficult for them to control. So try this music. No, that's what I'm telling. From my side, whatever I'm doing, I will record everything and pass it on to Mitra Foundation. You can go on giving.
Excuse me, ma'am.
Okay, this much I can do because I can't teach everybody individually at this age. Okay, otherwise, if God had, I am training probably within maybe few months, I can start sharing therapist number.
So this is a YouTube channel, ma'am, Nada Arogya.
Nada Arogya, yeah.
Okay, we will.
Dr. Meenakshi Ravi's Nada Arogya.
All right, so we will share it with the.
You can share and you can subscribe. We will definitely work together, Samyukta. I am very much interested to work for your organization. Yes, it's so beautiful. Such a wonderful initiative, to blending, integrating in the normal stream, it's such a wonderful, noble concept.
Thank you, ma'am. Definitely, we'll plan some programs in future.
Excuse me, ma'am.
I will invite all of you because I'll be arranging programs from special children, normally once in 2 months. Okay. So I will invite all of you, all can come and watch how, and you can listen to their feedback also, how they find difference. Yes. And if any from Mitra Foundation, if anybody wants to attend the course, it's going to start on this Saturday. It's a 6 months course. I'll send the details to you. If
yes, ma'am. Please share the details with me. We will share it in our group and people can contact
anybody
you.
Is interested, we can have a few more therapists in your group itself.
Sure, ma'am.
Yes.
All right, ma'am. So we'll end with maybe a couple of lines if you can sing for us, which is probably the favorite raga of your students.
Oh, yes, sure.
Ma'am,
Which
how
is
to
most
join for
popular.
Mitra group?
We've shared a WhatsApp group link, ma'am. You can just join the WhatsApp group.
Okay, ma'am. Okay, ma'am. Thank you.
Excuse
I sing a bhajan on Shiva. Okay, praying Shiva for the well-being of the entire universe. Om Namah Shivaya, Shivaya Namah Om. 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 Hara 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 Haraya Namah Om. Shiva 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 Shivaya Namah Om. Hara 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 Haraya Namah Om. Shiva 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 Shivaya Namah Om. Hara Hara Mahadeva. Hara Hara Mahadeva. Hara Hara Mahadeva. Shambho Mahadeva. Shambho Mahadeva. Shambho Mahadeva. Hara 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 Haraya Namah Om. Shiva 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 Shivaya Namah Om. Hara 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 Haraya Namah Om. Shiva 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 Shivaya Namah Om. Hara Hara Mahadeva. Shambho Mahadeva. Shambho Mahadeva. Shambho Mahadeva. Dhama 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 Dhamaru Bhaje. Dimitaka Dimitaka Mridanga Bhaje. Dhama 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 Dhamaru Bhaje. Dimitaka Dimitaka Mridanga Bhaje. Hara Hara Mahadeva. Shambho Mahadeva. Shambho Mahadeva. Shambho Mahadeva.
Thank you so much, ma'am. It was really so wonderful. And thank you all parents for attending the session. We'll be in touch regarding the details.
Thank you so much for
Thank
giving
you,
me this
ma'am.
wonderful
We'll be in touch.
opportunity to be with all of you.
So much.
Thank you.
Thank you, ma'am.
so much.
Thank you.
Bye. Bye.